my name is Richards Afonja. I'm a physician. I'm specialized in internal medicine, hematology, oncology, and I also do peripheral stem cell and bone marrow transplantation. And I've been in practice now for 32 years. Well, in oncology, there are different types of oncologists depending on what kind of diseases are being treated. So you have a medical oncologist, which I am. My job is to give chemotherapy, biologic therapy, gene therapy, vaccine therapy to treat cancer. There are radiation oncologists, there are gynecologic oncologists, there are surgical oncologists, there are orthopedic oncologists, there are pediatric oncologists. But I am a medical oncologist, and I also do bone marrow transplantation. Well, Dokita has given me an opportunity that I've not had in the last 32 years that I've been practicing medicine, because I will not only be able to impact lives on a one-to-one basis, but the technology will stand the test of time because other physicians can actually use it in their respective countries, whether it's in Africa or Asia or South America or anywhere else. So we are gradually impacting healthcare delivery worldwide, one patient at a time, one physician at a time. There's a physician component of the app and there's a patient component of the app. If you're a physician, you'll download the doctor's app. If you're a patient looking to get a consultation from physicians, you would download the patient's. It's free to download the app.
Yes.
The only time that we get paid is when patients see the doctor. The patients will pay to see the physician. Out of the payment, the physician gets paid, and we take a percentage of whatever the physician gets. Charity begins at home, so Africa is where we want to target, because that's where the need is the most. And because the need is mostly in Africa, we want to make sure that this platform is available to people in the rural areas who otherwise would have waited days before they get in front of a physician. That's if they ever make it there, because sometimes there's poor transportation, lack of funds, and even when you go to see the physician, you have to pay, getting the medication, traveling back to their areas. So removing all those obstacles actually would improve healthcare service delivery. If you have used the app Uber before, this is exactly the same way this app is being used. You are a patient, you have a doctor, you bring the doctor to the patient makes a payment, the doctor finishes consultation, gets paid. So if you have questions about a diagnostic issue that you have with patients and you're not sure how to solve this problem, this is a network of physicians you can tap into. Passion is one thing that you must have. If you do not have passion, you're likely to derail and stop when you hit the difficult roads. Number two, if you don't fail, you have not hit the right possible moment yet. You must have some failure history before and know how to solve these problems. Come above, make sure these problems do not sink you while you're setting up your entrepreneurial business, because it's only by solving these problems that you learn to continue to stay in the business.
Wow.
Until the business issues arise and you are able to solve them, you have not started yet. You go to dokitaapp.com, you can download, or you go to Google Play Store, you can download the Android version of Dokita. And as far as I'm concerned, I'm on Twitter at Dr. Afonja or at Dokita. I'll be reached. And that's the only thing. The Dokita is also on Facebook, and Instagram is being set up as we speak.